Today, half of all people that are going on Medicare are choosing to be covered by Medicare Advantage plans. But why is it that those of us that are experts in this business, those that are really skilled and trained and knowledgeable and have experience in this business, are so cautious about recommending Advantage plans? Why are we so concerned about them? Well, the reason for that is because we know how Advantage plans are going to work. Agents who push Advantage plans are only going after a big commission. They're not concerned about coverage. You see, you'll really never know how good your insurance is until you need it, and then sometimes it's going to be too late. So in this video, I'm going to explain to you Advantage plans, the good, the bad, and the fine print. These are things that you must know. I want to begin by making sure that you're aware of that when you go on Medicare, there are really only two different options of using your Medicare benefits. I call these systems, ways in which we use Medicare once we decide to be covered by Medicare. You cannot be on both of these at the same time. You have to make a decision which way is going to be best for you. And so let's talk about those just real briefly. Number one option you have for using your Medicare benefits is you enroll in A and B. This is the original Medicare system that started in 1965. A is the inpatient side of Medicare, B is the outpatient side, and all doctor-related services. All right, so when someone has A and B, what they're going to do is they're going to have some what we call gaps. You see, other than preventive services, Medicare doesn't cover anything 100%. There will always be a financial balance of the bill, a liability that you have, and again, we call those gaps. So on the A side of Medicare, we have 3 gaps. On the B side of Medicare, we have 3 gaps. Those gaps could include deductibles, they can be co-insurance, they could be co-pays, and they could also be called excess charges when a doctor adds 15% to the bill. But the point is we have these gaps, and so most people that stay in original Medicare do not want that kind of liability, so they will take that financial liability and transfer that to an insurance company, and when they do so, they're buying a supplemental plan, also called a Medigap policy. Right now, the top 2 plans are the G plan and the N plan. The G plan will cover 5 of those 6 gaps. The only gap G does not cover is the Medicare annual B deductible. This year, that's $226 once a year. After that, we have full coverage. Medicare covers, the G plan pays everything but the B deductible. Plan below that, not as popular, but some people are buying it, will cover 4 of the 6 gaps. Okay, so the N plan will not. Just like the G does not, it will not cover the B deductible. That'd be out of your pocket once a year, $226. But in addition to that, the other gap that the N doesn't cover would be called an excess charge. And this is when you see a Medicare doctor that adds 15% to the bill. Now, most docs don't do it, but some do. And if you incurred that excess charge, you would have to pay that out of your pocket on the N plan. In addition to that, the N plan requires every time you see a doctor, you're subject to a $20 copay. Go to the emergency room, $50 copay. So we have a little bit more out-of-pocket expenses. Now, when we buy these plans, we have to pay a monthly premium. And again, we're a nationwide company, so I'm just giving you some average so you can get your kind of mind around the cost of this. Right now, the G plans are about $125 a month. The N plans about $90 to $95 a month. Now, when I go this direction, I also have to have a drug plan. And those drug plans range anywhere from about $25 to $30 on a monthly basis. There are some lower for sure, some that are going to be higher, but that's a good average. So here's my point. When I look at this option, I have to pay my B premium. For most people, that's $164.90 a month. Now, just let me make clear. If you're a single filer and you make above $97,000 a year, that could be higher. A married filing a joint return, if you're above $194,000 a year, that could be higher. But 93% of all people pay that on a monthly basis. This comes out of your Social Security check, or they'll do a bank draft, or they'll bill you quarterly. So I have a monthly premium. My G or N plan, again, I'm going to have a monthly premium, and my drug plan, I'm going to have a monthly premium. So in this scenario, what we're doing is we're paying a premium, and we're pretty well not going to have anything else out of pocket other than prescription, some copays, because again, we're getting rid of the majority of that liability. And again, you can see by looking at the math, this is going to be in the neighborhood of about $315, $320 on a monthly basis. That is one way you can use your Medicare benefits. And frankly, this is what I would do. I'd actually go with the G plan because I don't like surprises. With the N plan, we have a couple extra surprises, and with the G plan, I can budget. I know I'm responsible for my B deductible only, and I can plan for that. But again, there's no right or wrong. You have to decide what's best for you. So the second option we have is we have to enroll into A and B. Now, by the way, this system came about in about 2003. They introduced the Advantage plans in the late 90s, but they began to really get them organized and implemented in the early 2000s. So when we have this option, we enroll in A and B, but instead of using the Medicare system as the one that's really directing our care and setting all the rules, now we're going to enroll into a private health insurance company's plan, and these are also called Advantage plans. They're also referred to as replacement plans, and they call them replacement plans because though you're enrolled in Medicare A and B and you still got to pay your B premium, you're not using the A and B system. You have a private health insurance company that is directing your care, that is overseeing your care, kind of orchestrating everything and ordering that care. So here it's a private health insurance company. Up here, Medicare sets all the rules, all right? And so with the Advantage plans, what happens is in this system here, we pay our $164.90, our Part B premium, but usually we have zero premium for the Advantage plan, and we usually have a drug plan that's also zero. It's kind of part of the package. So what we're doing here is we're paying less monthly because in this system, as you'll see in a few minutes, we're going to pay as we go. All right, so we have these two systems, and the only thing they have in common is I have to be enrolled in A or B. I've got to pay my B premium. Now let's look at the details of the Advantage plan. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. First of all, the good. What are the things that people find to be attractive about Advantage plans? There's really only two things. Number one, almost every market in the country today has an Advantage plan that has a zero premium to the insurance company. We already saw we got to pay Medicare, their Part B premium, but the insurance company typically has zero premium plans in almost every market. And the reason for that is because instead of paying a premium, what we're going to do is we're going to pay co-pays, all right? And so it's just a different way in which you're going to be out of pocket. We're all going to pay out of pocket, either it's premium or we just simply pay co-pays. So that's what makes these very attractive, and this is what agents like to really promote, zero premium. Now, the second thing they like to promote are what we just refer to as perks, and these are add-ons. These are benefits that are not in the original Medicare system, but these are things that the Advantage plan makes available to people. And so the first one would be a dental allowance. I don't call them dental plans, I call them a dental allowance because they typically give you about $1,000 a year to go towards dental services. True dental plan would be maybe $2,000 to $3,000 a year, but you have a dental allowance, you also have a vision allowance. And so original Medicare covers vision very well, but original Medicare doesn't pay for eyewear or for exams for eyewear. So the Advantage company will give you a routine eye exam once a year and credit towards eyewear, usually about $200 or so on an annual basis. They also will cover hearing aids. Now, they won't cover all hearing aids, but they will cover some hearing aids, some select hearing aids as well as networks. You simply would just have a copay with the plan. Also, many of them today will include a gym membership. Original Medicare does not do that, and so a gym membership, the two big networks are Silver Sneakers and Renew Active. And so if your community center, your Y, or wherever you want to go actually takes that, then you can work out for free at the gym. And then lastly, they also have this thing called a Flex Card. And the Flex Cards are really attractive for people that are on Medicaid, but for Medicare, they typically give you some over-the-counter benefits. You can, go on their online catalog and order a few things. But again, that's a benefit. And these are the perks. And these perks are really, really pushed by agents, honestly, that do not care about your coverage, but rather care about their commission. And so they're going to focus on premiums and on the perks. That is the good, for sure. Now let's talk about the bad. And in my opinion, I think the bad far outweighs any of the good that those other two items that we just looked at. But here's the bad. And again, rarely will an agent talk about this. First off, you're going to have providers. You will have limited providers that are going to take Advantage plans. Now, it doesn't mean to say there's not plenty of them that will take it, but it's limited. If you stay in original Medicare A and B and get a supplemental plan, you can go to any doctor that takes Medicare. You don't have a network. It's almost truly unlimited. But here we're going to be limited by providers. Why? Because all the Advantage plans are going to be HMOs or PPOs. And some doctors take none of them. Some may take one or the other or two, but not all providers, hospitals, and doctors are going to take Advantage plans. And so you may have a provider you want to see, but if they're not in the network, you're not going to be able to go there. And so that's the whole point with this. Now, what the PPO plan will let you do, they will let you go out of network. But you're going to have to pay more. You could pay as much as $10,000 max out of pocket for the year if you go out of your network. The HMO, other than urgent care or emergency room, you have to stay in your network. If you try to go out of the network, you'll be 100% out of your own pocket. And so again, we're going to have issues with this. So certain providers may be off limits to you. That's why we're saying that's a bad. And again, anyone that's an expert is going to be honest about that. Second issue we're dealing with, and this, in my opinion, is bigger than that one, and that would be what we call pre-authorizations. So a pre-authorization, just so you know, is not required to see your primary care doctor, to see a specialist, to go get preventive care, to have some just basic lab work. You'll not have to have those kind of services pre-authorized. But 70 to 72% of the services that you will need on the Advantage plan are going to have to be pre-authorized, pre-approved by that Advantage company before you get those services. MRIs, CAT scans, PET scans, skilled nursing stays, surgery, outpatient, inpatient, unless of course it's an emergency situation, you are going to have all those kind of things pre-approved. So just because the doctor says you need a knee replacement or a hip replacement or we need a certain service doesn't mean you're going to get that, because we have a pre-authorization process. So the doctor has to submit that to the Advantage company, and now we have somebody sitting in a cubicle that's actually going to make the final decision, not your doctor and certainly not you. The Advantage company has that authority because you now are on their Advantage plans. So they have the final say-so. They may say, no, we're not going to approve that. We don't think you need that knee replacement, that hip replacement. We don't think you need that extended skilled nursing stay. We're not going to pay for that. Or they may say, well, we want further review. We want you to go to therapy for 6 or 9 months before we pay for that knee replacement. Or we want you to try medications first before we try surgery. But the point is they have this authority now on that Advantage plan to say no to those services. Now, sometimes they say yes, and sometimes they say no, or they'll delay that. And so you have to live with that in the system. Again, agents who push them do not talk about this. Those of us who are expert, we care about this because we know the reality that you may need something that's going to be pre-approved and you may not get it. If you have that supplemental plan, you would never have the issue because Medicare says they'll cover it. Doctor says you need it. End of story. The insurance company has no say-so whatsoever. They're following Medicare. All right? So that's an issue. The other bad issue with these things is the fact that you are going to have to pay as you go. Pay as you go. So what does the agent talk about? Zero premium, all the perks. But the truth is, the majority of things that you are going to have to need on that Advantage company plan is you're going to have to pay. So if I go to the hospital, it's going to cost you $350 a day, maybe 5, 6, maybe even 7 days every time you're hospitalized. See a specialist, probably $50 a copay. If you have an MRI or a CAT scan, a PET scan, you're going to pay probably $250 to $300 for those scans, each one of those. Also, if you have an outpatient surgery, cataract surgery, knee replacement, again, probably $350. So it's a pay-as-you-go system. So almost everything you have done, you're going to pay, and you have no idea what services you're going to need. So what happens in this pay-as-I-go system is we take on the risk of whatever healthcare services we're going to need. Now, if we're going to stay perfectly healthy, there may not be a lot out of pocket. But if I have a health problem, there could be a tremendous amount of money out of pocket. Why is that? Because HMOs right now, max out of pocket for the year, are somewhere between $3,000 to $5,000. PPOs are going to be somewhere between $5,000 to $10,000 out of pocket. So you take on the risk of that max out of pocket, and that's an annual amount. And so all of our copays go to the max out of pocket. If we reach it, we're done paying, but then it's going to reset again in January. And again, we start paying as we go. So again, the agent focuses on zero premium, all the perks, but the truth is it's going to cost you something if you have any kind of a serious illness. So those are the bad items that you need to be aware of. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. And then lastly, and I'll conclude with this one, that's this. I call this the fine print. And the reason I call it that is because this is something that rarely will an agent disclose to you. And that is the fact that if you get on an Advantage plan and you stay on that Advantage plan a year plus, you're on the Advantage plan 5+ years for some period of time, now to get off of that Advantage plan, you are going to have to now qualify. In other words, you have to go through underwriting if you want to make the switch from an Advantage plan to a supplemental plan. all right? Most people think because we have this open enrollment every year, October 15th to December 7th, that we can just switch willy-nilly, make a very, any kind of decision we want, and we can make switches. And that's not true, folks. In all but 4 states, if you're on an Advantage plan 1+ years in the future and you want to get off of it and you want to move that supplemental plan, you are going to have to medically qualify. There's 4 states that don't have this rule. That would be New York, Connecticut, Maine, and Massachusetts. But all the other 46, we have to go through underwriting. So there's this process. We're going to ask you 30 health questions. You have to say no to all of them. We're going to check all your prescriptions that you're presently taking and anything you've taken in the last 24 months, and we may have to get a statement from your doctor. And this information, the prescriptions, the health questions, that questionnaire application, as well as that statement from your doctor will be submitted to that supplemental company underwriter. And if they don't like what they see, they're uncomfortable with certain medications, certain health conditions that you have, pre-existing conditions, they have every right to say, no, we are not going to approve that policy. And you get a big no, and that means that now you are on your Advantage plan permanently. And that is the fine print that Advantage agents don't want you to know. Why? Because number one, they make a good commission and they get paid a lifetime commission as long as you stay on that plan. And the truth is that could be your permanent coverage, never able to get off of that. Now, does that mean you have bad insurance? No. But it does mean this. You have to live with provider networks the rest of your life. You have to live with pre-authorization the rest of your life. And now you pay as you go. And you probably have some health problems because you can't medically qualify. And that could be substantial. So these are the things that you've got to know. And this is why those of us that are experts in this business are cautious and very concerned about Advantage plans.